Alrighty. Today with Dr. Arash, Prehab Guys, the beautiful sign in the background, Culver City. Check him out. He will help you for only $1,000 per 2 minutes. So we have Elbow Elvis. Got some medial stuff going on right now. We're going to learn everything about what's going on with the elbow.
Yep.
And we dug a little deeper, part of the case example, doing a lot of benching with the 531 with Wendler. That would typically be more lateral stuff. Don't have that, it's more medial. So as you ask more questions, you find out I was doing some straight bar curls, did a heavy set, and that's what jacked me up. And so let's hear it from the pro.
Yeah, so typically with any medial elbow pain, first you want to find out what the pain generator is. In this situation, it seems soft tissue related. When you're actively contracting, you have discomfort. If it was, let's say, a ligament or a bone or a nerve, you're more likely to think that maybe at rest or during maybe not so demanding tasks, you notice that pain. But when you're doing the curl, you notice some discomfort. That means it's probably some type of contractile issue. So first you want to figure out what the problem is. Now, if you notice during the curl you have discomfort and it kind of gets better, that's actually sometimes the case with tendinopathies. You notice a little discomfort, and as you continue to go more and more, you may notice it gets better. Now, it could also get worse as well, but you do know that there's something active that is the pain generator. So in that case, it would probably be something more like a medial epicondylalgia, where it's all these tendons that come into the medial epicondyle, where if the demand exceeds the tissue capacity, you notice that there's some type of discomfort. So this is not usually a thing where after one time of working out you feel the discomfort. It's typically over a couple of days, maybe over a couple of weeks of overuse. The demand being higher than the tissue capacity ends up breaking down the tissue. So ideally, if your capacity is here, you put demand up until that capacity, you break the tissue down, it rebuilds, it supercompensates and gets stronger. However, if you go too far, and if you do go too far for a few sessions on end, what happens is something starts degenerating, and the tendons in which all of these muscles attach to creates, it becomes slightly degenerated, which is where that pain may come from. And so that's typically the first thing. You want to figure out what it is. After you figure out what it is, then you go into plan of care, which should I dive into what?
Well, we said a couple of vocab words in there. So he was talking about general adaptation syndrome. So you have the alarm, you're going to have some resistance, you're going to adapt, you're going to get stronger. That's why we want to stick with lighter weights for newbies, but also for meatheads. So I hadn't done that exercise in a long time. I went too high.
Yeah.
So the demand was too high.
Demand was too high.
And so then there's going to be that result. And so ideally, I should have not been a meathead and started with a lower capacity, done some, maybe a couple of weeks of training, and then the tissue probably would have been okay. So that's why it's so important to lift light weights in the beginning with our beginning clients. And then also he mentioned the word that I'm going to butcher. So it's also, some people refer to it as medial epicondylitis.
Yeah.
Why don't we like to call it that?
Yeah, so that's a good question. It's like the nature of the injury is not an inflammatory one, which is why the term itis or tendinitis became popular in the first place. However, when you start looking at the newer research, it's not even that new now, maybe 10 to 15 years, we notice that it's not just an inflammation issue, it's actually the tendon starts degenerating. So it's not the inflammation that's creating the pain, it's actually the degeneration which creates, it's like this, if there's a tendon and you have some degeneration here, this degeneration will never come back. However, now if you start doing that bicep curl, you start loading the tendon that you do still have. And now you're overloading the tendon that you do still have. But the key here is to build up the capacity of the tissues that you do still have. And the reason why tendinitis does not make sense is that there's no inflammatory process. It's a tendinopathy, meaning that there's degeneration in the tendon, which is where my middle fingers are, that no longer help function as a tendon. It's the other part of the tendon that ends up helping the actual function of the tendon. So there's the idea of strengthen the donut, not the hole. So if this is the hole, the goal is to build up capacity of the donut, the outer part that's still intact. So the idea of a tendinitis being the case is just not physiologically accurate.
Okay.
So that's why tendinopathies or in this case, like medial epicondylalgia is just like a very general.
What is that suffix?
Yeah, I couldn't break it down for you,
It's
but
like
it's like
fibromyalgia, right?
Yeah,
is it the
yeah.
same kind of...
It's a very general term. That is less tissue specific than, let's say, medial epicondyle tendinopathy, for example.
Okay.
That way, at least you know that there is some type of degeneration.
So basically, icing wouldn't do much, right?
Correct. No, wouldn't do anything aside from numbing the area for a short period of time. Yeah.
So what would be the recommendation that we would want to work with?
Yeah, good. So if it's an overuse injury, it would make sense that at first you actually want to offload it for a little bit. So unloading for a very short period of time while you let the acute injury maybe heal slightly on its own. Now, that's not meant to be for too long. The problem is a lot of times people do that.
3, 5? Or...
Yeah, I guess somewhere between 3 to 7 days, I'd say, is typically the standard approach.
So then would you say, I did this,
Yeah.
don't work out for a week?
I'd say work out areas that do not exacerbate that area or don't require, like even if you're doing some other exercises with your arms, I would stay very, very light, if anything. But I'd say if you were a professional athlete, if you were coming to me as a professional athlete and you're in season, I know that you can only do so much. Now, if it's because you've got to play. If it's off season, I'd say the optimal way of approaching that is actually making sure that this is not loaded at all for a couple of days.
Okay.
So I would take it off. I would focus on other areas of the body. And then after that short period of unloading, you want to start reloading. And with reloading, you typically want to start with isometrics, long sustained isometrics. The protocol that's become really popular with tendinopathies are 5 sets of 45-second holds. So you're just going whatever. If it's a medial elbow pain, you'll focus on wrist flexion, maybe some light resistance with the opposite hand, super light, just pushing. 45 seconds is a long time.
Yeah.
You'll notice that you probably haven't done many lifts for 45 seconds after you hold
Well,
this.
because I love this. I'm laughing because my meathead, I always take certain things Arash will say, and then I just put them on steroids. And for somewhere, I remember the 45, but I don't remember the isometrics. I do remember the isometrics, but I don't remember the light. And so the other day I was doing 40 pounds hold. And then the next day it was terrible. I'm like, fuck, this is really bad.
Yeah.
So yesterday I did that while I was teaching the class just with my hand, and it felt significantly better today.
Better, yeah, just very light loads. Get the body, especially if it's like the first time you're starting to load it. Maybe after a couple of weeks of building up capacity and your tolerance is up a bit, then you can go to the 45-pound dumbbell or 40-pound dumbbell. But that's a lot of load to start with. So I would definitely start with some type of light manual resistance or having a resistance band that's pulling you down, making sure you get a little bit of wrist flexion here. You can also focus on pronation, the same thing with maybe a band pulling you across laterally, where you're focused on pulling the wrist down to pronation. That way you do build capacity of these tissues as well. The pronator is one of those muscles that end up of it. So like if you're anchoring it here for me, and then I'm bringing my wrist into pronation and just holding that for 45 seconds, that'll get all those muscles on that part.
Now, what if there's, so say like when I was doing this, my pain is like a 4 or 5. And when I'm doing it at 4 or 5, 20, 30 seconds in, it slowly starts to come down.
Yeah, good question. So and pain is subjective, so it's always hard to give a specific number, but most the research would suggest stay under a 4 out of 10. And then if it is a true tendinopathy, it actually should start feeling better with time, like you were saying. So you're holding that position, it goes from a 4 to a 3, and then maybe it stays at a 3, maybe it goes down to a 2, it starts feeling a little better. Isometrics do have this analgesic or pain reducing effect as well. So just doing isometrics are a great way, regardless of what's hurting in your neck pain. You do some it can always help with that pain response. But typically you want to stay below a 4 out of 10. And if for some reason, actually, some people are on the more aggressive side and they'll say, if you're holding this and you don't have any discomfort, let's say you're at a 0 out of 10, they want you to pull harder until you start feeling a little bit of discomfort. Because you want to lean into what your capacity is. That means you're potentially not pushing yourself hard enough.
Okay, I like that.
So some people will try to challenge themselves to make sure they get up to that 4 out of 10 and just hold there. So it's tough though, and it's a weird one because sometimes as you go, it feels better, and what their train of thought would be is actually continue to push harder or pull harder, or if there's manual resistance, push harder with the opposite hand until you start eliciting that same response.
Now, what's the thought process behind getting into the soft tissue, like in here?
like soft tissue manual
Yeah,
work.
so like doing stuff like, you know.
Yeah. So with that, I'd say there's not good research to support it. I typically like it though because of the pain reducing effect that it has just in the short term. I know I'm not healing anything by doing it. It's actually the exercises that are going to heal the area.
Okay.
The soft tissue work is really a tool to calm things down, make things feel better, decrease the nervous system's input to the area, and the patient usually feels more comfortable moving their arm after the fact. So that way they're like, oh, it feels relaxed. Now I can do exercises and maybe my pain is less because of that. And it's also one of those things that if I push hard enough into soft tissue, it's some sort of, it's like a desensitization tool where, like, think about if like a radio is at a volume of 2, and then I ramp it all the way up to a 10 and then pull it back to a 2, the volume will seem significantly less when I go from 10 to a 2. So the baseline pain relatively seems less after soft tissue.
It's more just brain stuff,
yeah,
right?
exactly. Yeah, and I would never try to change that narrative to make people think that you're healing something with that, because you're really not. But it definitely can make people feel better enough to where they can do what matters and what will heal the tissue, which is the exercises in the first.
Okay, so what about? I've watched stuff from Kelly Starrett, and he'll mention, you know, the voodoo floss and doing stuff to blood perfusion, nutrients, trying to. So is that not really doing much then with the? So the idea with your donut that you got, and the avascularity of the tissue, if you were to, you know, do something, I mean.
I would say the research doesn't support using that in terms of healing.
Then what's our gun for? What's that going to do?
The Theragun over there. I love using it, but the narrative has to be correct.
Would you use it here too?
I could definitely use it there for the same reason as I would use my hands, is to like desensitize the area, loosen it up a bit, make it feel better, feel comfortable with some pressure. Then the exercises seem like they're more tolerable because of it. The same thing with the voodoo flossing. Like, you can do pin and stretch techniques. You can floss it here. You can go through all that range of motion that you want to loosen up the tissues, and it will feel released a bit because the nervous system is decreasing its response there. But it's not actually fixing or changing the integrity of the tissue. I mean, in terms of blood flow, like, I would just do an upper body ergometer or go for a run or something. You're going to get a lot more blood flow just from that.
So with the programming that we have, like a core movement pattern of squat into another core movement pattern, say a chin up, and it doesn't irritate it. So would you suggest just doing a prehab like that before the workout, then do the workout? Or would you suggest adding in after the chin ups as part of the workout, like you're doing that for 45 seconds? What would be the upper limit that you could incorporate that would be?
So I would say, and by the way, I didn't go through the full, after isometrics, I would progress it to doing isotonics with any movement where I'm going through the range of motion eventually. Isometrics is usually the first phase, and with isotonics, you want to be careful with going through too much range of motion. I'd start with smaller ranges and then eventually work your way into larger ranges for, in this case, wrist flexion and for forearm pronation. But in your question, I would definitely, if there's pain, like if you're like, oh, I just really need to curl today and it's not feeling too great, I'd say let's start with 5 sets of this, maybe even less sets, maybe 2-3 sets, just to get the tissue to have some type of analgesic response, get the tissues activated, and then from there, I'd have you do it. And if all is good, I probably wouldn't load it up anymore. The most important thing to look at is the overall volume of stress on the area. So it's hard to answer that based on knowing what else you have done that day or that week. So I'd want to make sure that on a session by session basis, there's slowly more volume that's added to that forearm. So that way your capacity, so the demand's here, we broke the tissue down a little bit. Now, instead of putting the demand up here, let's put the demand here. It's going to build up a little bit. Put the demand here, build up a little bit. So every single session, I'll slowly build that up. And making sure that the volume is there. And I probably wouldn't start with a full 3 times 10 reps of chin-ups. I'd probably slowly ease my way into it, maybe doing band assisted at first, and then...
But if there's no pain, you can do it?
Yeah, if there's no pain, I would definitely,
I'm just thinking on how, from a trainer's perspective, it's tough to stay in that. Obviously, you got to stay in your lane, but having a client who's a type A personality, they come in and they want to put size on. Their elbow's a little, iffy. And so the best suggestion may be to take a couple days off, but they're already there and they're like, let's just kind of push through it. Where do you draw that line, and where are you doing too much and overstepping our boundaries?
Yeah. With actually, there's surprisingly moderate research to show that having a strap can actually help with
like a brace?
Elbow. Yeah, a brace. Okay. It more with lateral than medial, but it can, because it kind of acts like a pseudo attachment of the muscle, where if you clamp it down hard enough, apparently the muscle now pulls where the brace is over where the insertion is, which the pain is upon the insertion typically. So there's something you can do there if the goal is just to get through a session. Now, if there is discomfort that's there, isometrics regardless, even if someone just has maybe there's no true physiological damage that's there, maybe there's just slight overuse. You can actually, I didn't want to get too technical, but there's the difference between a reactive tendon that's painful and degenerative tendon. So you can still have a reactive painful tendon without it fully being degenerative, and you want to be careful, because if someone does have that pain and you push through too much, it can go from reactive to degenerative, in which you will never get that tissue back. You will only degenerate it more the more you overuse it. That's why you have to respect overuse injuries, and you can't push them too much. And I don't want to scare people by that. It's not really that big of a deal. I'm sure I have tendinopathies all over, but the idea if there's pain and you're pushing through it just because you want to get jacked and it's a tendinopathy, you got to think about it, especially with the upper body. The lower body, there's a lot of soft tissue with patella tendons, Achilles tendons. Those are huge tendons. With the upper body, with rotator cuff or some of these medial lateral elbow pains, they linger because people have overused it for so long and they never really did true prehab for it, and kind of just pushed into it. They don't do their exercises, they just play tennis every weekend. Yeah. Well, you have to build up capacity for that activity, or else you're going to continue to just create irritation without building up capacity. So, that helped
that's
answer.
Absolutely great. So I think we have plenty of info for elbow Elvis. You can start implementing some of those exercises. So I did jump the gun with my brain, wanted to learn more about my injury, but as you said, start with the isometrics, 45 seconds, 5 sets.
5 sets, yep.
And then you would go into, that progression would be when to get into the isotonics, eccentric and concentrics.
Basically, what I do is I'll see if I can still create a fatigue sensation and the pain response. And sometimes people are like, I have this, maybe it's a 40-pound weight and I'm just holding this and I feel no discomfort. At that point, I'd be like, okay, let's go down to 20 pounds. Let's start going through some isotonics, and hopefully we can get some fatigue there. And with isotonics, typically with tendinopathies, you actually do want to go pretty heavy. I mean, for the upper body, it's fairly light compared to the lower body, but you'll see with patella tendinopathies or Achilles tendons, people will load as heavy as they can. Actually, the quick story, the idea of loading for tendinopathies was created from Alfredson's protocol. Alfredson's protocol was this physician.
Is that an
A? Alfredson's, yeah. So he was a physician who did surgery, and his buddy came. He's like, I've got Achilles tendon pain. Can you fix me? He's like, I can't do any surgery for you until you tear it. For this, there's no surgery I can do. So what he did is he tried everything that he could do to tear the tendon. He put backpacks of books and crazy heavy things and a lot of volume of heel raises, as heavy as he could to try to, and then he saw him again a couple months later and was like, how's the Achilles tendon? He's like, honestly, I tried to rip it and tried to break it, but I'm better now. And now that became popular in terms of the Alfredson's protocol, which is an insane amount of heel raises for Achilles tendinopathy. And now tendon is tendon regardless of where it is. So the treatment is still to try to go heavy to build tendon capacity, but you don't want to go quick. It's heavy, slow resistance training. So if you're doing these exercises, you want to go slow and you want to make sure that you have control with it. You don't want to use momentum as you go through these motions. And that's lower body. Upper body, you're not going to have as much strength as your lower body will. But you do want, that's why I like that you did 40 pounds. That's a lot of weight. I've never gone even close to 40 pounds with anybody. But that's a great way to build up capacity of these tissues here.
So maybe I just jumped the gun a little bit on that one.
No, but to your question though, I would at one point, once isometrics start feeling better, I don't have to necessarily go one or the other. I'll start throwing in some isotonics maybe within that session, just getting some reps in, make sure that feels fine, and then maybe the following session I'll do primarily isotonics at that point. So it's like a slow progression based on their capacity and how they feel, and then once isotonics are there, then at that point maybe we can work into some compound exercises as well.
Great. Prehab Guys, their app is out. Tell them about it.
Oh yeah, the app. Basically, we've got programs ranging from rehab to prehab, mobility, performance, and fitness. It's a follow-along app where if you or anyone you know is looking to get out of pain, prevent injury, or optimize performance, the app will take you through a guided program. There's also new workouts where they're not as high of a commitment level. It's just one session. Also similar to programs where you can get out of pain, prevent injury, or just improve your performance.
It's a great library to get into as a trainer, to download that. It's better to go to the website to do it though.
Yeah.
Go to the website, get the app, and then when you have a client who cancels, you can go through the app, and then a lot of the stuff, you have medial stuff, Achilles stuff.
It's all
access
protocols.
To all injuries.
Yeah, basically there are protocols that are basically in there meant for the consumer, but if you're looking for some type of protocol for, like, let's say medial pain, elbow pain, lateral elbow pain, Achilles tendinopathy, like all these things are in there from a rehab programming and a prehab programming. And then there's some other things as well, but that way you have a step-by-step exercise program, but also there's education along the way, conversations that we usually have with patients in the clinic.
So you'd save so much money if you were to not get a corrective exercise cert, get the app, and then when you have free time, you're going through that. So you're prefacing the time when some dipshit like me comes in with elbow pain, and you can go, you know what, I have this access to these exercises that I incorporate, and then you can start doing those, and you're gonna help your clients. So it's a really great app, definitely highly suggest it. And
thanks, Chris.
Prehab.com.
Yeah, the Prehab Guys, the prehabguys.com/membership is where the app will be.
All right, thank you, sir.
Cool. Thanks, Chris.